This is Average Joe PT, where we're here to reduce anxiety, improve function, and master your pain. Isn't that right, Scully?
We're back in the studio!
That's right. And now we're back in the studio, and this next 4 videos that we're going to start with tonight is all about lower back and specifically disc issues. We're going to be talking about the anatomy, the nervous system when it comes to having a disc and radiating symptoms. What is sciatica? What is this radicular numbness, burning sensation that I have in my leg or my arm? We want you to stick around, and we're going to go ahead and talk about that in this episode. If you are new to this channel, we'd love to have you subscribe down below, hit the bell. Scully and I, we bring content, live streams at least 3 times a week. We drop our edited videos on Sunday. So if you're new, we'd love to have you be part of our family. So let's go ahead and get started right now. So let's go ahead and get started with the different types of disc issues in our spine. Let's start out with there's a bulge, and that's when the disc itself starts to push out, not onto the nerve, but right next to the nerve. A herniation, which is one step worse, is where it's pushing right onto that nerve that comes off of the spinal cord. And then you can have a leaky disc, and you can have a herniation that goes into a rupture, and then you have fragmentation where it actually breaks off and it's just kind of floating in there, that disc is. More than likely, you'll probably need to have some sort of surgery. And stay tuned, videos down the road are going to be talking about those types of problems. Isn't that right, Scully?
That's right, it's going to be 4 videos!
That's right. Now, there's 4 different kinds of disc. We're talking about a degenerative disc, and then you have a prolapse disc, then you have an extrusion, and then you have a sequestrization. I'm going to leave a little pic right up here, and that's going to show you exactly what I'm talking about. Those 4 phases, what happens to a disc when it starts to break down. Now that outer part that we can see here is called the annulus. That's a very thick tissue, and there's no nerve endings in there or within that little space, that leaky, fluidy stuff that's called nucleus pulposus. And I'm going to leave a pic right on up there so you guys know exactly what I'm talking about. And that pulposus starts to leak out as that annulus starts to tear. Now there's no nerve endings within the disc itself, so you're not feeling any of this happening. It isn't until it really starts causing inflammation either along the nerve endings, as you can see along the spine here, or it starts really affecting the joints on the back side of the spine, or unfortunately if you start to get muscle spasms and stuff like that, then you're going to realize, something's going on, something's wrong. But those are the different phases of a disc issue and a disc problem. So let's go ahead and have you stick around. I want to show you the relationship between the nerves and that burning symptoms and what your disc has to do. Stay tuned. So Scully, what do you think about this presentation so far? These discs are very important, aren't they?
I wish I had my spine back.
You wish you had some? Yeah, maybe at some point, maybe we can glue your head on top of this spine here, and lo and behold, you have your own spine again. Wouldn't that be kind of cool?
You're not funny.
Oh, come on. Calm down. It's not that bad. He takes everything so serious all the time. But let's go ahead and get started with the nervous system itself. I'm not going to go into too much detail. I'm going to give you a decent idea what happens when you're having this burning sensation down your leg, or numbness or shooting pain that some people might describe as sciatica or sciatic type symptoms. What happens is that nerve coming off of the spinal cord, right about there, it starts to get pinched or gets inflamed. And all of a sudden it starts sending signals saying, hey, there's something wrong. And when that happens, your back muscles start to lock up, or what we call muscle guarding, to try and support that actual joint. Now, when you start having weird kind of symptoms, whether it's in your arm or in this case in your leg, we have certain charts that we go by that can tell us where your actual problem is along the spine when you're describing your issue in your leg. So if you have symptoms in the bottom of your foot, like right here, let's say that your symptoms are down here on the bottom part of your foot, that's actually your S1 nerve, or your sacroiliac nerve 1, way down below this last disc. That nerve is getting inflamed and is giving you some symptoms on the bottom of your foot. If we're talking about maybe the inside of the foot here, or along the inside of that leg, we're talking about the L5 nerve. And so on and so forth. When we're going up the leg, we're talking about L2, L3 in that area along that thigh. So as you can see, L meaning the lumbar spine, there's 5 lumbar vertebrae that make up that spine. And any one of these nerves or cluster of nerves that gets irritated and you start having symptoms in certain parts of your legs, these what we call dermatomes, that I'm going to leave a chart right up here, gives us a good idea which nerve is affected in the spine that's giving your symptoms in your leg. When we talk about treatments for this type of problem, you're going to want to see the next video that we come up with next week. It's going to be about treatments that you can do at home to reduce your symptoms. And the first thing you need to reduce is the nerve issues, the neuropathic symptoms, the burning, the numbness, the tingling, and maybe even the weakness that you feel like you're having in that leg, that heavy crampy sensation. You need to address that first before you can work on the lack of motion or the weakness that you have. So that's the first thing you always want to address, is the nervous system. So stay tuned for next week's video on home treatments that you can do at home to master your pain. Scully and I want you to go ahead and hit this next one right up here. It's going to go over all types of treatment techniques that you can do at home to reduce your pain. And so if you're new to this channel, Scully and I would love to have you subscribe down below and hit the bell, wouldn't we, Scully?
Hit the bell, hit the subscriber button,
That's
people.
right. So until next time, we want you to look up and keep smiling. See you next time, folks.